Hi, I'm Nancy Blotner. At Caldwell College, we believe that all citizens need to be informed about the important issues that affect their daily lives. That's why we're proud to support the programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by Meridian Health, Johnson & Johnson, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons PC, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. And by New Jersey Natural Gas, proud to support education in our communities. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
I'm Steve Adubato. More importantly, we have him back. Dr. Walt Guarino. He's a partner in a firm called Practicom. It is a virtual communications agency. Is that true?
That's absolutely right.
You admit that?
Yes, I do.
Okay. You have 30 freelancers.
That's right.
Describe the firm. By the way, you have spent 40 years before this, let's say a more traditional, full-service communication firm?
That's right. The big brick-and-mortar houses.
Yeah. How's this different?
Well, it's a world of difference. I have 3 partners. We are all considered independent practitioners, but we've had a lot of experience together, and we know a lot of the same people who do different kinds of things in our business. So we're able to call upon these people with a good deal of knowledge, and we're able to target our communications in a way that you never could, because, for example, in a large agency, if you want to do an annual report, you get the team that's been doing your retail advertising and your other advertising. They may not really be experts at annual reports, but they get the assignment. When we get a report, an annual report assignment, we get people who really are specialized in annual reports, and we bring them on. So we target the people to the job before the job is targeted to the end user.
Do you have that kind of flexibility?
It's incredible. Absolutely incredible flexibility. And everybody sort of works in a kind of community way. I mean, we get clients from the people that we call to freelance. So we put our own expertise into it as well.
This is interesting. You know, we go back a long way with Walt. Walt's been a professor at Seton Hall in the field of advertising and branding, communications. Walt's has been an expert for a long time analyzing Super Bowl commercials, you know, what works, what doesn't work, who just got ripped off because they just got a bad buy. And also Walt is in fact a board member, a longtime board member of the Caucus Educational Corporation, the company that runs this production. And Walt and I have had a lot of conversations about branding and advertising and marketing. 40 years in the business before you made this move.
Yeah.
And you loved what you did, but something didn't feel right. What was it?
The things that really didn't feel right, and I wish I'd realized them about 10 years ago, but it's sort of this freedom and fulfillment kind of feeling that you don't totally get when you have a, quote, boss. To make your own decisions in terms of what you want to do. It's sort of like, you know, there's a great expression that when you get up in the morning and you can do what you like to do, you're a success.
Yep.
And there's a lot of that kind of esprit and spirit. So one, it's a psychological boost to do it. Secondly, it's a different world because you're able to take on kinds of clients that you normally wouldn't be able to take under a large agency's aegis.
Because the large agency would say no, they're a startup, the risk is too big, the return we don't see. No, Walt, we're not taking them.
Right.
And you say, yeah, but Jim, I see the potential. Jim says, Walt, that's not your call.
That's right.
I know I'm oversimplifying it.
No, that's absolutely true. There are guidelines that the agencies have in terms of minimal revenue expectations, and the clients have to meet those deadlines and those requirements. So it's kind of tough to do certain things that you want to do. And one of my clients now is very fulfilling to me. This fella invented a protocol which is guaranteeing that the plastic food wrapping and packaging and containers that you use don't contain any animal byproducts or meat. Now think about...
is that what that is right
that's
there?
That's ERC group, yes. That's the, it stands for Ethnic and Religiously Compliant. So that now when people meet this standard, which is 1 part per 40 billion pure, you can't get purer than that, then people will know for the first time that there's no meat in here. Now think about the vegans, think about kosher, think about the Muslims, and the millions of people who are ingesting something that is either against their religion or their will.
And your agency is able to take that on. That would not have happened, you're thinking, in a more traditional firm.
Not likely, because there's no money at all right now.
Yeah, well, let's talk about the money.
Yeah.
Because you're running a business.
Yeah. Well,
we're a nonprofit, as you know.
Yes.
But we're running a business.
Yeah.
We don't bring in enough money. We don't have these cameras and these very highly, overpaid camera people.
Right.
You like that guy? We have a great team. I mean, the bottom line is you are running a business, black and red. You got to make your budget.
That's right.
What about that part of it?
Well, what you do is accounts like that, you fit into your 24-hour workday. Somebody said, that's the problem when you go free. You're going to be working 24 hours. But I say, well, I get to pick the 24 hours I want to work.
What does that mean?
Well, I can adjust my schedule and fit things in. I can take it at my pace as opposed to having to be told where I have to be when. And that allows me a lot of freedom. Plus, look at the time that I don't spend commuting anymore. I mean, that's a couple of hours a day.
Social media changed things?
Social media is probably the reason. Probably the
Make
reason. I think it's the whole reason why a bunch of people are doing what I'm doing, whether it's in communications or their various fields. The important thing about social media is that you can now do things that you could never do 10 years ago because you couldn't afford to do them.
For example?
Well, for example, even places like Kinko and Staples and those kinds of places are available so that you can deliver very professional products. Online software is available to deliver very professional looking products. And the entire internet is filled with coaching and people who tell you how you can succeed, and whether you use LinkedIn or whether you actually go out there and look for blogs on the subject. Executive coaches, life coaches, people that can tell you how to meet expectations, how to brand yourself, how to market yourself. And the whole networking capability is available right in your own dining room.
But in the end, how much of it still comes down to retail, face-to-face, being with people, making those deals that cannot be done through social media and the internet?
Well, the thing is that the way business is being done today, mostly e-tail, which is growing rapidly, e-commerce, is where the personality and the face-to-face is really coming from your website, from your internet site. That has to make the first initial appeal. After that, then there is a time for close and some human contact. But unless you can do the right things to get people to your website and they can learn about you and take another step, you're not going to succeed anymore. And even the big companies are realizing this. And social media lets you drive the traffic there because there are tons of free ways that you can use. Once you learn them, they're very simple to drive traffic to that site.
Before I let you out of here, Walt, you've been in this business 40 plus years. Your advice to someone else who says, hey, this is interesting. This guy spent 4 decades and now he's doing it. But I don't think it's right for me. Do I have what it takes to be an entrepreneur, you say?
I say most people are afraid of the risk. So they probably cover up that risk with the feeling that they're not capable of doing it. But somebody gave me advice a while ago, and they said, write down on a piece of paper 10 things that you think you could do if you ran your own business. And then the second thing they asked me to do was write 10 more. And then they said, look for the overlap. And I just found that the things that I really was excelling at from teaching as well as the actual practical business was branding and on social media. And those are the 2 things that I focused on to go out on my own.
You love it, don't you?
I love it.
Dr. Walt Guarino, partner in Practicom. Thank you, Walt.
Thank you so much.
Always learn something new when you're here.
Ah, thank you.
Appreciate it. Stay right there. One-on-one will continue right after this. Good stuff, Walt.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org or find us on Facebook at facebook.com/Steve Adubato, PhD.
There she is, Kathy Grant Davis, President and Chief Executive Officer of the New Jersey Primary Care Association. Good to see you, Kathy.
Thank you. Glad to be here.
You have been with us many times talking about a whole range of healthcare issues. By the way, let everyone know what the Primary Care Association is.
Primary Care Association is the trade association for the federally qualified health centers, otherwise known as FQHCs.
Now, the FQHCs, federally qualified health centers, where are you?
We're all over, 113 sites. We're in 20 counties. We serve anyone who walks in our door by federal law. Most of our patients are indigent or without insurance.
You know, as we put up the website for people to get more information, I always hear people say, oh, Steve, I saw that show you did. That's about a clinic, right? But it's not a clinic.
We don't use the word clinic anymore. When I came into this job 20 years ago, we had the clinic model, but we're now medical homes. We've expanded our hours. You come in, you see the same doctor, you get the same team of people, and many of our centers are now patient-centered medical homes as accredited by either JACO or the National...
JACO is?
The Joint Commission of Ambulatory Health, forget what the O is.
They always have all kinds of acronyms.
I know.
They're the regulatory body that comes in and says you're good.
Exactly, and says you're good. And then there's another one, which is NCQA, which focuses only on quality. So we're getting those standards as well.
As we approach the fall of 2013 doing this program, a lot of things are changing.
Yes.
Right? This program will air before or after. But here's the thing. You have told our producers, and you've said this many times publicly, that you believe that healthcare reform, it's about to officially happen in January of 2014, but it's really happening as we speak.
Yes.
You believe it's a really good thing for the people you serve. But here's my question. What's supposed to happen? Is somebody from the federal government supposed to knock on someone's door and say, here's this card, you now have insurance, health insurance that you didn't have before?
Yes.
That's not going to happen. So why is it good?
It's good because it'll give people a better range of services. Right now, we do a lot of primary care. If you have coverage, you have access to specialty care. You then have access to hospitalization. It'll cut down on charity care as well. Now, part of the issue... Charity
care is you go to the emergency room.
That's right.
You must get treated by law.
That's right.
And then that bill
is astronomical. But if we do a better job because people have coverage, coverage means you come in with a card and somebody is responsible other than the patient for paying. Primary care is really the key to healthcare reform because it's the front end. Similar to me, I'm diabetic. Someone needs to manage my care. If my care is managed, I don't end up getting sicker. So it is a good thing, but there are some things that are happening that aren't so good.
Go ahead.
Number one is that I don't think we have enough physicians.
So let's play this out. You keep saying that the key is primary care.
Yes.
If you get really good primary care, you'll have fewer trips to the emergency room.
That's right.
Fewer trips to the emergency room, that's a good sign. That means
Yes.
people are healthier. But
Yes.
we don't have nearly enough primary care physicians.
That's
Therefore,
absolutely
what
right.
is the answer?
We have been recruiting. We're working with the Council of Teaching Hospitals. We're working with the Department of Health. We're using more nurse practitioners. So we're trying to expand that model. And the other thing that we've done, I think we've done it well, is that we're looking at different ways of doing our model. As an example, everybody doesn't have to have an appointment. We now have what's called open access. You come in, we see you as quickly as we can, and we're not stacking up the waiting room. We actually have some physicians that we don't even give appointments to. They are there only for walk-ins.
Describe what happens. Someone comes in to one of these community health centers.
Yes.
One of yours.
Yes.
They don't have to have an appointment?
In some cases, no. In some cases, yes. Like
how would they know the difference?
The type of patient that you are. So when you first come in or you call, if you're an OB patient, we typically like to get them on a regular schedule. Better outcomes. But if you call and say, I have an earache today or a sore throat, I'm not sure what's going on, we try and get them in without an appointment. So it depends on the service. Some services you really do need to have scheduled appointments versus just walk-ins. So we play both models.
So they walk in, what happens?
We walk in, we do the intake, we do the financial screening, and they will go to see their team of providers. And a team of providers for us is a medical assistant, a nurse, and a physician.
So the whole team?
We work on team concepts, interdisciplinary care.
But here's what I keep thinking. We've done so many programs on our sister program, Caucus New Jersey with you, and Capital Report, our other program, public policy programs.
Yes.
But one-on-one is more about the human side of things, less about policy and politics. On the human side, I always worry and wonder about how people are supposed to get the information. Like there's something called a healthcare exchange that the federal government is responsible for. The Christie administration opted in New Jersey not to be responsible for this. The federal government is now handling it. Each state has their own choice as to how to handle this. Here's my point. Where's the average person watching this program? Say you're watching us in any state, New York, New Jersey, Connecticut, Pennsylvania, wherever. How would someone know how to go on this so-called health exchange, which is on the internet, and pick, as if they were going on vacation or picking a hotel, which kind of health insurance they would want? Because now, based on the new Affordable Care Act, they are now eligible for health insurance based on so-called Obamacare. How would they do that?
I'm glad you asked that question.
Because that's the question I don't have an answer to.
I have an answer for you. There are what are being called navigators.
Navigators.
Navigators, which is part of the federal law. We will have navigators. We collectively, the health centers, have hired 69 of these people. Their job, get out in the community, walk people through what they need to do, help them go on the website. Not only do we have navigators, the hospitals are going to be doing outreach and enrollment. Private groups like Citizen Action, other groups like Enroll America, Outreach America, churches. So there's information. Our people will be trained by the federal government.
So hold on. You're in New York City.
Yes.
You're in Newark, you're in Atlantic City, you're in Philadelphia, you're in Baltimore, you're in a lot of different places, cities, say along the Eastern Seaboard. How does one, living in those communities, disproportionately where people are, it doesn't mean if you're in a rural area that you may not have been eligible, and now you are because of so-called Obamacare. But say you're just in these urban areas, how would you know where these people are?
We know where they are. We've been working with this population for 20 years.
No, but how would these people know who these navigators are?
The navigators are required to be out there going to churches, supermarkets, beauty parlors. They are required to be out in the community providing this information.
In the streets?
Yes.
Grassroots?
Absolutely.
Person to person?
Absolutely. The way we used to do it when I was growing up. I won't say how long ago that was.
But like really, really in the streets?
Yes, in the streets, grassroots, with materials in various languages as well, saying to people, you are eligible, let me walk you through this process.
Before I let you out of here, National Healthcare Week, even though this will air later, National Healthcare Center Week is?
August 12th through the 17th. We have 72 events going on around the state of New Jersey.
And by the way, even if this is seen after, just remember National Healthcare Week should be every week.
I agree.
Katherine Grant Davis, President and Chief Executive Officer of the Primary Care Association here in New Jersey, but there's one in every state. Great stuff.
Thank you.
Keep it up.
Thank you.
This discussion will never end. By the way, you're a diabetic, but you lost 28 pounds, and you have gone from however many medications you were taking now to
really 1.5, and I'm getting rid of that half. So soon I'll be down to just 1.
Look at you, taking care of your own self.
Yes, I am.
Thank you,
I feel
Kathy.
Great. Thank you so much.
And you look great. Appreciate it.
Thank you. Thank you.
Talk to you soon.
Okay.
Hey, stay with us. We'll be right back right after this. 28 pounds.
Yes, yes.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org, or find us on Facebook at facebook.com/Steve Adubato, PhD.
Kathleen Kelley, Professor, Department of Nursing, Caldwell College. Good to see you.
Thank you. It's very nice to be here, Steve.
We're about to, in a little bit, we're going to see Sammy, who is a simulated what? Guy?
He's a simulation mannequin. He's a high-fidelity simulation mannequin that we use at Caldwell to deliver great immersion experiences to our students.
That's amazing stuff. We're going to see some B-roll of that in a minute. But I need to know something. How the heck did you get into nursing?
It's actually a long story.
Well,
but
we don't
I'll
have
make
that
it
much
short for
time,
you.
so give me the short version. Give me the public television version.
There you go. I went to engineering school to Stevens in Hoboken, and I practiced for a while in electrical engineering. And when I had my kids, I decided I wanted to do something a little different. And much to my father's chagrin, I left engineering and went into nursing.
Love it?
Love it.
Why?
It's not every day that you can make a difference in the world doing anything that you do, be it teaching my friends, my family, making a difference in patients' lives. How many people can say that? I made a difference today. I helped someone.
But the teaching part, because the clinical part, I hear you, but where's the teaching part come in?
Well, that's the future. It's the future of nursing. To be a teacher, I can develop the next wave of nursing students, which I think is amazing, and make sure that they're ready to come out and take care of me in the future, if needed, my family, you, anyone.
But teaching has changed, because this mannequin that you're talking about wasn't around 10 years ago?
Not when I went to school. It wasn't. It's really unbelievable. We use Sammy in our simulation lab to allow my students
to have... Can we talk about Sammy?
Oh, there he is. I'm actually working with one of my students here, and we're talking about how to take care of a central line that has become displaced. And it's more than just teaching my students how to do it, talking to them about it. They actually get the hands-on skills of doing it. It's very different from just learning. Well, because now they have to do it. They have to do the right thing at the right time to the right person and watch what's happening as they're doing it. Not just answering a question on a test. I would do this. Can you physically do it? Can you get in there, get your hands dirty, and deliver the right interventions and, you know, gauge how the patient's doing through it.
But how does Sammy, this mannequin, react? Say you don't get it right.
Well, then we actually program the mannequin that if the student doesn't do what's expected, Sammy doesn't do well.
Could you be, because you told me in the green room, before we got in here, that Sammy's body, as a mannequin, actually responds in certain ways. Go ahead.
He can sweat, he can vomit, I can make him seize, I can change his heart rate, I can change his lung sounds. We can change anything. He's very dynamic, he's fully programmable, and it's unbelievable how the students become so immersed in this reality of the scenario that I've created for them.
Sorry for interrupting, doesn't it create, Kathleen, some degree of stress for them?
Well, it does.
Is that good stress?
It's a good stress because it's less stress than if they were in the hospital caring for a live person. This is a comfortable, controlled, safe environment that you can make a mistake. We can back up and do it again. And you do it again and again so that you become competent and you become an expert in what you're doing. And that whole fear of I'm going to hurt someone or I'm going to offend someone or I'm not going to do it right has been erased. Now they know they're practicing in a safe environment.
What I'm curious about is when the students sign up to go into the nursing program, do they know that this is part of the curriculum?
At Caldwell, many of our nursing students come in prior. When they're searching for a school, a savvy nursing student will look into a program and see what educational experience does this college have that makes them distinct from other colleges. So I encourage any nursing student to do that. You want to look and see what educational experiences are available. So the students come into the simulation lab before choosing Caldwell, and we actually show them. I do a simulation scenario with them, and they can see Sammy at work, learning with them.
Let me ask you, while this is happening, are all the other students standing around, or is that student the only person there? That's what I'm curious about.
It really depends. It depends on what educational experience I'm giving. My attention is with Christine at the moment, working with her on her skills, that nursing student. But usually, I have 6 or 8 other students who are watching.
Wow.
And
like you're doing rounds?
Exactly.
Except with Sammy.
Except with Sammy, but this allows me to give the same experience to every student, which makes learning good conformity. It makes it high fidelity, which is important.
I want to shift gears. I know that another area that you're very concerned about, that we've been doing more programming on, and we'll be doing much more programming as we move forward into 2014 and beyond, veterans' mental health issues. Why is it important, and why are we not doing enough?
It's important to me personally. It's where my capstone project for my doctorate is. I'll be integrating veterans' health into the nursing curriculum. I think it's really important because the veterans that are returning home from current conflicts, Afghanistan, Iraq, are coming home with signature injuries, traumatic brain injury, post-traumatic stress disorder, and it's that combination of injuries that are being seen in the community hospitals. Veterans are seeking health care outside of the VA system. And nurses in the community need to be prepared and educated to best serve this vulnerable population that we have.
Are they?
I think we're getting there. I think the wave of the future of education is to make sure that our nurses are savvy to treat this, not only for the veterans. Look what happened in Boston. We have a bombing at the marathon. Nurses in Boston weren't treating veterans then. They're treating American citizens who now have, from the blast injury, traumatic brain injury, post-traumatic stress, absolutely. Look at 9/11. So some of the injuries that we're seeing in the community are even mimicking what the veterans are coming home with. So for me, ensuring that our nurses that I'm teaching now will be prepared to treat, assess our veterans coming home is very important.
You make a shift from engineering to nursing. Any regrets?
No regrets at all. No regrets at all. I loved what I did in engineering. It was fun. I was young. It was great. It taught me how to think on my feet, how to solve every problem. And I used a lot of that in nursing. I can rig up suction to suction anything. I can use equipment to do anything. But nursing, the individual aspect, the personal aspect, is something I never regret.
Right before we get in here, I got 30 seconds left. I met your husband. What's his name?
Michael.
What do you think he thinks of you?
I hope he's extremely proud. He's very supportive. He supported me through career changes, multiple educational experiences, going for my master's, going for my doctorate. He's always been right behind me doing it.
We've had a fair number of clinicians, nurses, physicians, others. I'm always amazed by the work that you do and the degree to which you care, and you honor us by being here. Keep doing what you're doing. Thank you very much.
Thank you for having me.
We appreciate it.
Thank you.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by Meridian Health, Johnson & Johnson, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.
I started feeling this pressure in my chest.
The doctors and the nurses that were attending to me, that they were of such excellence.
They were wonderful. You know, they put my mind at ease.
I owe my life to them. I don't think I really would be here if it wasn't for them.
Because of the way they handled everything, I think that's really why I'm here.
I felt that I was in good hands.